Hi, I'm Edward Jacobson. I'm a gynecologist who's been in practice for over 30 years. My primary office is in Greenwich, Connecticut, and I have a secondary office in Beverly Hills, California. The last 10 years of my practice, I've specialized in restorative vaginal surgery, vaginal rejuvenation, and labiaplasty reduction. I'm glad you could join me today. We spend a few moments in this session to give you some more information about labiaplasty and what is involved in the surgery. Many women have called to express their concerns about what's involved with labiaplasty surgery, what are the possible side effects of the surgery, what can I expect, what's the cost of the surgery. Well, these are very important questions that should be addressed. I've received a few letters and emails that I'd like to share with you that'll cover some of these points. I have a letter from Sharon from Pasadena, California, who writes, "I've wanted to do this for a very long time. When I spoke with my gynecologist, she told me not to have the surgery, that I don't need it." Well, you have to understand there's a wide range of normal when it comes to labia size and shape and regularity. And it is your prerogative to say you can do what you wish, what kind of surgery you wish to have, and for whatever reasons. Most patients that I see have issues with swelling and discomfort with exercise. They're concerned about form-fitting clothing, and some people just have cosmetic issues. But it's your choice and nobody else's. I have a letter from Annette from Manhattan. "Tell me what I can expect after the surgery." Well, you'll probably take about a week or so to heal. You'll be able to resume your normal activities, going back to school or going back to work. You won't be able to go swimming or take tub baths for several weeks or do strenuous exercises that would disrupt the surgical repair. And you won't be able to make love probably for 4 to 6 weeks afterwards. Julia from New Canaan sends me an email to ask about what's the cost of the surgery and does insurance cover the surgery? Well, that's a good question. We all have a budget. While cost is an important factor, it is not the only factor. And probably the most important factor is selecting a professional who has the experience and the expertise to give you an excellent final result. The surgeon's fee isn't the only issue. There is a cost of the anesthesia and of the surgery center, and a lot of the fee depends upon the complexity of the surgery, and it depends upon the length of time and surgery. So I can't give you a straightforward answer about that. What I can tell you, unfortunately, is that virtually no insurance company will pay for this surgery. Now, Linda from Potomac, Maryland says, "I'm traveling a significant distance. What happens after I leave the area?" Well, these surgeries are designed to be problem-free when you go home. I call patients very frequently afterwards to make sure they're doing well. I'm available 24/7 if any problems arise, and you'll never feel you're more than a few minutes away from me at any time. I've received an email from Dina, who comes from London, England, and she says she's coming from overseas to have this surgery, but she's never been out of the country before, and she's very concerned about transportation and arrangements. Well, that's why we set up a concierge program whereby you can be met at the airport with a private car and brought to your hotel. We've had already made arrangements for your reservations, and all ground transportation to and from the surgery center and from my office. It is a seamless process. It's very anxiety-free. In fact, many women will come over several days beforehand to enjoy Manhattan and the sites in Los Angeles if we're having surgery out in California. To get a real feeling for what this is about, let's do this. Come with me, I'll show you around. We'll talk about what's involved in the process. We're standing in the reception area of our office in Greenwich, Connecticut. Initial contact is usually made by email, a letter, Skype, or even a telephone call. Once someone is interested in learning more about this surgery, they come down to the office and they come and they meet our staff. Let me introduce you to my patient care coordinator, Paula, and if you're getting involved with the surgery, then you will be working with her to make arrangements for medications and directions and so forth. And there's our nurse, Roxana, who also helps out in the office. The most important part of your visit, of course, is the consultation, and this is where I learn about what your desires are, what you envision to have with the surgical repair. Okay? This is a time where we sit down and talk about your medical background. I get to learn a little bit more about you. we do an examination. So let's come on down and take a look at the examination facility. In the examination room is where we have an opportunity to have you show me what your concerns are and gives me an idea of what type of surgery to plan out. After the examination, we go back into my office, we'll look at some before and after photographs, and ultimately find what you envision you would like to have. From there, I can design a specific surgery. We're standing now in the reception area of the Greenwich Hospital Ambulatory Care Center in Greenwich, Connecticut. This is one of 3 outpatient surgery centers that we use for surgery, the others being in Stamford, Connecticut, and in Beverly Hills, California, the 90210 Surgery Center. All facilities are highly accredited and licensed by the state, and they're the ideal location for this type of surgery. We're in the preoperative section of the Ambulatory Surgery Center, where you would come after coming through the reception. You'll meet nurses like Jane and Marina, who will be taking care of you just prior to going in for your operation. The surgery is done under twilight anesthesia, which is the lightest level of anesthesia. You'll wake up approximately 2 to 3 minutes after the surgery has been completed. You go to a recovery room, and then you'll be discharged an hour later from the surgery center. You will go home pain-free, and you'll stay pain-free for 8 to 12 hours because of the long-acting anesthetic that I'll administer after you're asleep in the operating room. Labiaplasty can be done several different ways. It can be done with the scissors. It can be done with a laser. My preference is to use radiosurgery because it cuts the skin very, very accurately without causing any damage or thermal damage, and it allows for the healing process to occur very, very quickly with minimal discomfort. After you leave the surgery center, you'll go home, you'll be hearing from me. You'll come back and see me the following day for a follow-up visit before you're discharged. This is a modern operating room, fairly typical of the surgical facilities that we operate in. If you have an interest in seeing what goes on when a labiaplasty is undertaken, there's a video clip that you can view on our website. After the surgery is completed and you go home, there'll be certain limitations in your activities. You won't be able to go swimming or take tub baths. You certainly cannot do strenuous physical activities that would interrupt in the healing process. It will take approximately 4 to 6 weeks to allow healing to completely occur, and you'll have to refrain from lovemaking at that time. This is pretty much a broad brushstroke of my practice. I hope you've gotten a feeling for the type of care that you can expect to receive when you come for your surgical procedure. And even after the procedure is over, my availability to you by cell phone 24/7 is always there, which I hope you will appreciate.